We've petitioned the technology gods in the hopes that we don't lose the connection. We'll be discussing the goalkeepers report for 2020, of course, which has a lot to say on the COVID-19 pandemic and how that has impacted our road to the Sustainable Development Goals. Bill, I'll start with this question. This year, you gave up your seat on the Microsoft board in order to dedicate more of your time to philanthropy and the work that the foundation carries out. Why is this work so important to you? Put another way, why are you on this call with me and not on a beach somewhere saying to yourself that let the SDGs be somebody else's problem?
Well, Melinda and I decided back in the year 2000 that the wealth I was lucky enough to have from Microsoft, and then later our friend Warren Buffett put a lot of the wealth that he got from Berkshire Hathaway into a foundation whose primary focus would be global health, viewing that all lives have equal value and looking at why so many children die. At that time, over 10 million children were dying every year, and they were dying of things like diarrhea, pneumonia, malaria that we should be able to prevent. And so we're experts on infectious disease. A lot of our work is in Africa. More recently with the pandemic, now our work is important globally, not just in developing countries, because our expertise on vaccines and which companies are good at what and how you develop those things. So, this year has actually been a very intense year. As the pandemic hit, our role of being able to work with governments and companies has been more important. So I've really streamlined things so that our foundation can play a big part in making sure over the next couple of years we bring this entire pandemic to an end.
How has your foundation sought to ensure that the funds it contributes to its partners? The report talks of a HIV positive mother living in Homa Bay, and you got that information through one of your partner organizations in Kenya. How do you try and ensure that the funds you contribute are actually going to what it was intended for?
Well, I'd say the health sector is easier to avoid corruption than many other sectors. It's a lot easier to avoid high levels of corruption than it is, say, for a construction contract, a road contract, things of that nature. So we're pretty careful with the health money, including partners like Global Fund and Gavi.
I know your foundation has primarily focused on the residual pandemics, to borrow a term from the report, and there was a lot of concern initially that Africa would be disproportionately affected by the COVID-19 virus, but we haven't seen scenes such as those we've seen in Italy, such as we've seen in Brazil, or even the US where you are. What do you make of that?
Well, so far it's good news that the amount of COVID sickness in most of Africa has been fairly low. Certainly there's a benefit that you have a younger population, and this is a disease that in terms of death and serious sickness is mostly older people. Obviously in the rural areas you don't have the same indoor activity. Clearly when you're indoors, breathing the same air, that's a big factor here. We're a little bit worried that the disease is there in Africa and not being fully measured, so it's probably a bit worse than we know, and we're still worried that it would take off, but so far so good. It's been mostly South Africa that's had a large number of cases.
One life lost to the COVID-19 virus, of course, is one life too many. But in Kenya, we've actually been seeing a decline in the numbers of infections reported, leading some to make the connection or connect the dots to imply that perhaps the COVID-19 pandemic was manufactured or was the risks it posed were exaggerated.
Well, that requires leadership, because you're right, when you don't have much of the disease, then people are mixing together and not wearing masks, and then all of a sudden it catches you by surprise. We had this in the United States where there were a few states that were very affected, like New York, and the other states thought that somehow it was never going to come. And then sadly, we had a huge second wave in those other states like Florida and Texas. But, Africa so far, it hasn't been the direct deaths of COVID. It's been more the indirect effects that have been negative, like the disruption to the health system.
The report also makes reference to inequality in terms of poverty. It states that 37 million people have been plunged to extreme poverty by the COVID-19 pandemic. In the same breath, one man has broken records as far as personal wealth is concerned. What do you make of that inequality?
Well, sadly, this epidemic is exacerbating inequality. The rich countries have been able to throw more money at the problem. Even within countries, it's people living in slums, people who do physical work as opposed to office work. Clearly, you can have tax policies that tax the rich more and use those resources to help out with broad safety net programs. But every country has to get good at deciding what its tax system looks like and how to make sure that's very well enforced.
And you don't think capitalism is the problem?
Capitalism, versus, say, communism, it's clear, you can look at North Korea versus South Korea. Capitalism has worked. Now, how we have results like, say, the Nordic countries that have done better on equality through a progressive tax system, every country has to look at the maturity of its tax system and, how well it can run that safety net or broad social programs like education.
This inequality has just not been witnessed as far as economics are concerned. The report speaks about African Americans and Latinas in the U.S., for instance, are being disproportionately affected by the COVID-19 pandemic. Again, I suppose also related to economics. It also happens at a time when the issue of Black Lives Matter is quite live in the U.S. How do you propose we go about bridging that gap?
Yeah, it is tragic that at the same time we saw a brutal murder of George Floyd, we also have the inner city, including Black Americans, suffering disproportionately from this COVID disease. And so I'm hopeful this is galvanizing people to look at, how do we get the police to behave better, find those police that aren't doing the right things, and look at the, health access that we have in the inner city. The U.S. has a lot of work to do. The beauty is our political system has a lot of energy in it now to try and reduce some of these inequalities that have been going down over time, but people are dissatisfied that hasn't happened fast enough.
The report also makes a big point or makes a big case for the equitable distribution of vaccines, such that the vaccines don't only benefit those in higher income countries. Why is that important?
Yeah, our foundation is going to do its best to make sure the distribution is equitable. Part of the way we do that is by getting additional factories that are dedicated to the low and middle income countries. Some of the factories are dedicated to the rich countries, and we're not going to be able to go and change that. And so by adding more factories, using money from the foundation and relationships we have and special aid money that a lot of the European countries have been very generous on, we should be able to supply in parallel. And our report shows that that would have a dramatic benefit in terms of reducing the number of deaths. But this hangs in the balance. Part of the goal of the report is to point out the inequity here and the need for cooperation. It's really a novel situation. I'm hopeful that the countries will all step up to this, and we will get the vaccine out starting next year to the entire world to bring the pandemic to an end in 2022.